Jim, like many patients with diabetes, they have their ups and downs. And diabetes, as one of my patients once said, you never get a vacation.
Yeah, I was diagnosed when I was 16. I was put in the hospital right away and started on insulin right away. And then I was real lucky in the fact that my dad come in and he looked at me and he said, you have it and you can't do anything about it, but you can live with it. And it just sunk in.
And so he, like most of our patients, had their ups and downs. Unfortunately, what Jim found out is that sometimes even though you work very hard at things, do everything that's asked of you, sometimes things don't always work out quite the way that they hope to.
Jim was referred to us from a local podiatrist for a non-healing foot wound. And during the course of meeting Jim, we realized that he needed some extensive procedures.
It was a challenging situation. He has already had some partial amputation of his feet, and now one of the incision was not healing, and he was being actually considered for a further amputation.
Diabetics in particular are told that they have small vessel disease and there's nothing you can do about it. But the fact of the matter is that a lot of those people also have large vessel disease, and we can do a lot about that. That was the turning point in getting something really done for him.
The outcome probably would have been an amputation. And we know that on average, an amputation has about a 5-year, 50% mortality rate. It's imperative that we really take the time and make sure that all of the processes and procedures are done before we look at an amputation.
Because each doctor is focused on their particular area of expertise. And without somebody organizing the entire process and prioritizing which things need to get done first, it's difficult to get a good result.
We just have awesome communication with our teammates and with the patients too. All the physicians in my team, as well as the nursing staff, and the coordination of the communication is imperative. So making sure that we communicate daily with each other, making sure that all the dictation goes out, as well as making sure that phone calls, one-on-one conversations of where we're going with the care of the patient, and we call that coordination of care.
Obviously, coordinated care is important, and anytime we can do that, we're going to produce a better product for our patients, and I believe we're going to have better outcomes.
He healed, and that was the most important thing.
In a different time, in a different era, he may very have lost both of his lower extremities below the knees. And so in terms of Jim now being able to return to work, being able to enjoy the things that he life, is it ideal? No. But really, in many respects, it was a success.
I want to go back to work to prove that I can do it. I figured it could be a lot worse. Could have been my whole foot, could have been, a lot of other things. But it's getting better.
So we hope to have many years together working in building and continuing to strive to really achieve our ultimate goal, which is for our patients with diabetes, that they have successful lives, to do the things that they enjoy their families together, and I hope we're on track in helping Jim accomplish that.